Hi, this is Dr. Swolensky, and I want to talk to you about a drug-free approach to treating learning and behavioral problems. Children are a source of happiness, laughter, and love. Children are our future. There is nothing less at stake here than our very future itself. Yet by 1975, 150,000 American children were being drugged to treat a little-known condition called hyperactivity disorder. By 1997, that number had skyrocketed to 4.4 million. Today, there are an estimated 6 million children in the U.S. diagnosed with attention deficit hyperactivity disorder, taking powerful psychiatric drugs for a disease that may not even exist. Is hyperdeficit hyperactivity disorder really a disease, or is it symptoms with various causes? Some quiet symptoms of learning disorders are making frequent mistakes, failing to pay attention to details, not listening when spoken to, losing things, forgetfulness, easy distractibility, etc. Types of active symptoms are fidgeting, squirming, talking incessantly, blurting out answers, etc. As all of us were children once too, we have all experienced or demonstrated these symptoms. Yet parents are often told that their children need to be put on Ritalin, Adderall, or any number of other drugs in an attempt to quickly cure their hyperactivity. Drugs are recommended and often suggested to help scholastic achievement, yet according to the U.S. Drug Enforcement Administration, a review of 17 studies using 55 independent measures of academic achievements showed that psychostimulants have no long-term benefit effect on scholastic success. Learning disorders are manifestations of symptoms that may be traceable to irritation or malfunction of the central nervous system. When balance is restored to this system, the symptoms improve. There are a variety of ways to accomplish this. Natural therapies support the body's innate ability to heal itself. According to research by Esteban A. Gineo, MD, hyperactivity can be a sign of toxicity or nutritional deficiency, and in most cases, both. Research done by Dr. Darrell links hyperactivity, learning problems, and violent behavior to a fundamental lack of minerals. Symptoms of mineral deficiency can include nervous system dysfunction, memory loss, hyperactivity, restlessness, confusion, depression, irritability, poor concentration, insomnia, fatigue, nervousness, and much more. Environmental factors that can also trigger hyperactive symptoms are chlorine in the water, chemicals in furnishings, decorating products, cleaning products, insect repellents, pesticides, dust, mold, aerosol disinfectants, school air, and pollen. Children who are having reactions to food and or environmental allergens run the risk of being falsely and incorrectly labeled with a learning disorder. There are two possible approaches to treating a child with learning or behavioral symptoms. Drugs such as Ritalin, Adderall, Cylert, Dexedrine, Cyban, Levux, Zoloft, or a drug-free approach by removing irritants to the nervous system. The most commonly prescribed drug to treat so-called learning disorders is Ritalin. It's now being replaced with Adderall. Ritalin has been classified as a Schedule II drug, just like cocaine, by the Food and Drug Administration. A 2002 study estimates that as many as 10% of all school-age children have ADHD, and that your child has a 7.5% chance of being diagnosed as having ADHD by the time they graduate from high school. However, in a landmark decision, the Colorado State Board of Education passed a resolution that recognizes that there are documented incidents of highly negative consequences in which psychiatric prescription drugs have been utilized for what are essentially problems of discipline, which may be related to lack of academic success. And they resolve to encourage school personnel to use proven academic and or classroom management solutions to resolve behavior, attention, and learning difficulties. Is a learning disorder a chemical imbalance? Enthusiasts for drug treatment claim hyperactivity in children is a biochemical imbalance. T.J. Moore of Washington University Health Policy Center disputes this idea. He says the chemical imbalance theory has not been established by scientific evidence. Pediatric neurologist Fred Ballman, medical doctor, wrote to several government agencies requesting they refer me to one or few articles, peer-reviewed journals, that constitute proof that ADHD is a disease. In response, the Food and Drug Administration said, no distinct pathophysiology has been delineated. In response, the U.S. Drug Enforcement Administration replied, we are unaware that ADHD has been validated. In response, the National Institute of Mental Health confessed, we have not yet met the burden of demonstrating specific pathophysiology. Is ADHD a real disease? The National Institute of Mental Health does not have an official position on whether ADHD is a neurobiological disorder. Just as there are causes of a cough, whether by flu, bronchitis, tuberculosis, there are problems or there are causes of learning problems, whether it be nutritional deficiency, nerve irritation, medical condition.